try to answer the questions if we can. And if we don't get to them, we have some time reserved for questions there during the webinar today too. And next slide. So a quick overview of today's agenda. We'll do a few introductions from the Smartsheet end and introduce our special guest of honor, Regina from Tanner Health. Regina is going to walk us through her solution that she's built. And we'll take some questions from that, and then we'll break out into some small groups for a little bit of discussion, and then close everything out from there. And some quick introductions. So this is the account team from the Smartsheet side that supports Regina and everyone at Tanner Health. My name is Drew Dean. I've been with Smartsheet going on 8 years, and I work mostly with healthcare and life science customers. We also joined by Katie Reed, who is one of our senior solutions engineers. Katie helps customers like Regina and Tanner Health identify problems and propose Smartsheet solutions to address those problems. Also have Sean Birmingham from our customer success team. He has worked extensively with Regina in shoring up her existing solutions and providing an enablement and training to everyone there. And next slide. So our guest of honor, Regina, I'd like to introduce Regina Shelnutt. She's an accomplished healthcare accreditation and quality management professional with a rich background in regulatory compliance, patient safety, and clinical operations. Regina is pivotal in guiding the organization through rigorous accreditation processes, utilizing her Joint Commission healthcare certification to uphold the highest standards of care. Her extensive experience includes developing and implementing compliance protocols, facilitating cross-functional team collaboration, and embedding best practices into daily healthcare operations. Regina's expertise in risk management and process improvement has been instrumental in ensuring Tanner Health meets and exceeds accreditation benchmarks, enhancing overall patient quality care and organizational accountability. Known for her strategic insight and commitment to continuous improvement, she's a trusted leader in healthcare compliance, dedicated to advancing quality standards across the industry, and just a really cool person to be able to be with and see what she's done there. With that being said, I'd like to introduce Regina.
Hi, everyone. Thank you, Drew, for that kind introduction. I don't know who that person is, but I'd like to hire them. So I appreciate all the nice words and the confidence that you guys have in our organization and the processes that we've built here. And I really appreciate everybody coming out to kind of see what we've done. At the end of the day, I'm an end user just like you guys are. And we feel like we've come up with a good solution that helps our compliance and accreditation process be a little more streamlined. And I'm really happy to show you what we've done and see how you may be able to turn that into something for your own organization. So hopefully you'll be able to take several tools back with you.
Awesome. Thanks, Regina.
All right, let me tell you a little bit about the company that I work for. I work for Tanner Health. We are a 5-hospital system across the state of Georgia and across Alabama. We have 2 acute care hospitals, 2 critical access hospitals, and an inpatient behavioral health hospital. We currently serve more than 450,000 people in our service area. We have one of the largest groups, or I think it is the largest group in the state of Georgia for a medical practice. We have more than 40 practices under one umbrella. We have more than 4,500 employees. The total today for providers is over 800. We deliver more than 2,000 babies over 2 hospitals, provide 21,000 plus surgeries over the course of 4 hospitals, and have over 130,000 ED visits over those 4 hospitals. So it's a pretty big organization. I have been blessed to be here for 37 years. And I have worked in the ER, but I also started in accreditation in 2006. So in hospital accreditation, not sure how many of you guys are in the hospital sector, or you may be in other areas of industry, but hopefully some of these tools will be able to take you, you can use them, just translate into your own accreditation or survey processes. Next slide.
Awesome. Thanks, Regina. So before we dive into things, I wanted to briefly highlight some of the common problems that we solve across the healthcare industry. So today we're going to be focusing on accreditation management, but we come across common challenges, for example, in portfolio and project management, procurement and sourcing, unifying departments across hospitals, healthcare organizations, and life sciences. So some of these problems aren't exclusive to healthcare, but today we are focusing on a healthcare solution that Regina has developed. And naturally, some of these problem sets are tied to each other. So if we address accreditation, that's going to trickle and address many of these other problems as well. So that being said, I'm going to pass it to Katie to talk a little bit more.
Thanks, Drew. So at a high level, when we think about managing accreditation in the Smartsheet platform, regardless if it is Joint Commission related or if it's for another accreditation, we think of it as a life cycle. So we think about the accreditation serving to help with strategic alignment. So not only are we feeding the results of accreditation into future planning processes, but also focusing as an organization, what do we want to achieve and how is that accreditation going to help us achieve that? We can also think about managing the application. So we all know that different accreditations require recertification after a certain time threshold. And so Smartsheet can certainly help with managing those key dates, milestones, as well as establishing those clear lines of accountability. Today, we're really going to focus on the survey readiness as well as the survey execution piece. And I'm not going to steal Regina's thunder, so I won't dive too much into it there. But as we think about prepping and ensuring that our organizations are ready for an on-site survey, and then how are we actually managing the on-site survey and collaborating and sharing information across our organization. Additionally, we support continuous readiness. So again, as we are collecting the results from the survey, we can feed that again into our strategic planning process, and we can use that for process improvement initiatives within the organization as well.
So I'm going to take the first three of these and how we address the gaps in accreditation management. The first thing is the single source of truth. Historically, we had files of tracers and things that we had done surveys in our organization in Word documents, or we would send them out through SharePoint. A lot of emails going back and forth, and we tried to house the master copies, but making sure that we had the final product and the most current product was super important. And Smartsheet allows us to do that. So all of our stuff is housed within a specific set of workspaces so that we can at any given time go to those, and anyone can go that has access can go in and look at those and see the historical information that we're maintaining there. Automated alerts, I don't know if you use these in your current roles, but we use a lot of these because it saves our staff from having to go back and hand communicate with staff if we're needing some explanations of something, if something hasn't been resolved to the point where we feel it should be. The automated alerts are triggers that will let people know we need something. It also keeps us on task with our timelines because they get reminders before things are due, and they also get a little bit of an audit reminder when things are past due. So it just allows us to not have to do that hand, each one. The accessible and on the go, we use our mobile devices continuously. I would say every day we are in our mobile devices using the Smartsheet platform. It makes it so much easier than trying to do just a laptop or a desktop. So if you haven't tried that option, it is certainly one that you should give a try.
Thanks, Regina. And then the final piece here that you may or may not be aware of is that Smartsheet does provide features and functionality that will allow you to meet your regulatory obligations, including HIPAA. So fun fact for those that may not be super familiar with that. Okay. All right. And thank you, Regina, for sharing a little bit more about where the Smartsheet platform fits in and how it helps you solve some of those challenges. I wanted to bring up this slide and then hand it over to you to talk a little bit more about the actual content within your solution and how that benefits you and Tanner Health.
Okay, this is a very high-level overview of how we have started using Smartsheet for our regulatory compliance prep and also our survey process. So you can see at the very beginning, it starts with the application and the tasks that we are required to do within the Joint Commission. So all of our applications live within Smartsheet, so staff can go in and respond to those as needed. Also, if you're hospital, you know about the focus standards assessment. that they used to require. Now it's optional, but we still require staff to do that annually to ensure we are in continuous compliance with all of the standards. The next part is the survey prep, which is where we do our departmental tracers, our walkthroughs, and our chart reviews to ensure that everything is as good as we would like it to be. This has a reporting function, so we can check and see what things are still compliant, or if they're finished, if they're not finished, or if they're overdue. For survey execution, we use it for several features. It has its own workspace. We have scribe center notes where our staff is taking notes as they follow around the surveyors in our organization, and we'll dig into that a little bit and how we use that in real time in our command center. We also use it for document requests so that we're not using as much paper, printing as much paper as we previously were. We have also revamped our competency file for the HR session to streamline that process and use some dynamic view for that. And then finally, our TJC survey response, which is the initial thing of what got me started on this path to Joint Commission. So just a quick note of how that started in just a minute. The last thing that we do is some dynamic views. I don't know if you purchased that as part of your package through Smartsheet, but if you don't, you might want to talk to your account exec. Not a sales thing. I don't work for Smartsheet. I get no compensation for this, but we have found it to be super helpful, and it's something that it's relatively new to us as well. So I got a lot of training on it on the seminar that we went to in October out in Seattle with Smartsheet, and it really is a nice enhancement that gives you some opportunities that we'll show you a little bit later. But to give you just a quick backstory of how I came to be with Smartsheet, our COO that we had recently hired back in 22 handed me the software and said, here it is, see what you can do with it. But at that point in time, we were post-COVID, but Joint Commission was still really behind on their surveys. And so we had one hospital that was 9 months late being surveyed and another hospital that was 5 months late. They were due initially like 4 months apart. They got surveyed the same week. So our staff is 4 deep. So we're a very small staff. So we had to pretty much divide and conquer that survey process, which we were fortunately able to do. But during the process, it started me thinking about how we could work smarter, because I knew whatever the findings were for both locations, we were going to have to manage this with some of the same leaders and not get them crossed over and figure out how we could just do this better. So what was actually born was the survey response tool that I'm going to show you in just a little bit. And then that kind of just morphed into everything else that you're going to see. So I think, are we ready for me to start my slides for my show?
If we are, absolutely. I'll hand it over to you, Regina.
So I'm going to start at the beginning for us. Hopefully you can see the screen.
Yep.
You can see it.
Okay, great. We're going to start with the form. This is the way we do all of our tracers now throughout our organization. It starts with a simple form. Instead of taking notes and transcribing things, we do our mobile device and we take this into the actual departments. And you'll see that there's only 4 questions on here. All we need to know for any tracer is, where are we? If we're just saying we're in ICU, where are we in ICU? We're in nurse's station, or we're in room 1. What do we find? And can we take a picture? And I will tell you that taking a picture is a game changer, because people sometimes don't believe that you found what you found until they see it in a picture. Also, ceiling tiles tend to look a lot alike. So when you're talking about a stained ceiling tile, having a picture with some frame of reference for the engineering staff is very helpful for them to be able to go back and find that. So would highly recommend that you take a picture. One little caveat that you should know, though, about the forms in Smartsheet: you can only take a picture within a form if you're on a mobile device. So if you're on your laptop or something like a Surface Pro that you can use as either or, those are considered computers, not mobile devices. So if you're on your phone or an iPad, that works fine. Otherwise, you just take the picture with your device and upload it later. The other thing that we've done is, you can see there's an assign to section here. I've made some shortcuts. Some of our people get assigned a lot on tracers, such as our clinical engineering, our engineers, environmental services, and then our HR team. So I've made some things that will automate into that. So when we see that it's just saying a ceiling tile, we can go ahead and assign that to the engineering team, and that will roll into the the sheet below so that we don't have to make that assignment when we get back to our workspace. It's already done for us. So truthfully, by the time we finish with our walkthrough, our tracer is almost ready to go out. Just a little note also about how many tracers we've done for the year at Tanner. Our team of 4 has done at this point for the year 135 walkthroughs over 5 hospitals, which is pretty phenomenal considering that, you know, we previously could only do maybe 1, possibly 2 a week. Now we're rolling out 1 to 3 a week every week. So we have been able to widen our breadth of what we're doing for our organizations, just to ensure that we're always survey ready and that we are visible to the staff that need us. So just to let you know, once this form is submitted, it goes into the underlying sheet. And I'll show you what the tracer sheet looks like.
Regina, that was all pen and paper before?
It was all pen and paper. Then we would have to go to the desktop, type it up. We didn't have because it was just a different kind of process. So basically it was just, we were telling them what they did. They would send us back their resolution. We would have to put it into the master file. So a lot of back and forth with the staff. We eventually got SharePoint, which was better than we had. But with SharePoint, you have to check it out, check it back in, and we were continuously having people forget to check it back in. So the problem of having only one person in at a time was a challenge. So with Smartsheet, as you know, everybody can be in it at the same time, and it causes no disruptions. And you can see who's in the sheet at any given time, and you can see what they're doing. Things highlighted as blue. So when we get back to our space, this is what we'll see. We see the location, the finding. This is what we typed in on the form. It automatically populates the start date of the date we did it. There's a formula that tells them that they have 2 weeks turnaround time, and everything starts as not started. And then when the staff get it to resolve it, they will type in the resolution, any additional comments they want us to make, and when they completed it. We also put assignments in. This is the one that I told you that some of them have a number of assignments. Our HR files have, I think, 11 assignments for that. So having the opportunity to have that automate instead of having to type those names in each time is huge. You'll see that there's some color-coded automation for this as well, and this is based on the status. So everything not started is white, everything in progress turns yellow, and everything that is complete turns green. Now, if the date is passed and the status is still not started, you'll see that go to red. And that gives us just a quick visual of what's going on with each tracer as we open it up, so we're not having to actually read through each line if we don't have that kind of time. Another thing it does is we have an automation based on the assigned to and the due date. So the staff who have these assignments, if it's not marked complete 3 days prior to the due date, they will get an automated reminder that they need to go in and complete that. And you can do that right from the email that you get from Smartsheet, or they can come into the form directly and complete that off. They also, as I said before, get a notice 1 day prior if it's late. So those are all automated. We don't have to touch any of that. So we're able just to go back in at a little later time. For those of you in the hospital sector, we also do chart reviews of every clinical location that we visit. And I want to thank Katie for all the information she populated in here. I think sometimes she might have been in an organization, but we're not going to say for sure. Some of her things are spot on. So what we see in our organization, I'm sure you see the same. But we are looking at the charts for the locations that we go to. We're just kind of following along with the patient to see what they had. Was their pain, this one she put in, was their pain consistent? Was it reassessed based on if they got any pain medication, or was their titration correct? Was it, they got blood, was it administered correctly? Were the consents complete? So we're kind of looking at a nice overview, and I'll show you a really good tool that we've built to support this as well in just a moment. We're also looking at employee files. During the HR session, as most of you know, they will pull anywhere from 10 to 20 employee files. So we do a sampling of these for every department we go in. This gives HR a chance to look at the files and see if everything is complete, or if there's anything missing they need to gather and put in their holding thing. We also include the education department, employee health, and the laboratory for any clinical staff, so that we can check their active check competencies, their onboarding, their ongoing competencies for whatever department they're working in. So we have, just as a note, we have self-identified as a part of this process for the employee files So we had some new managers, and they were not all informed that they needed to be uploading their staff competencies into a certain digital location. So HR was able to identify this and get some education out to those staff members so that they can make sure those are updated. This just makes, we don't know that these staff members are going to be the ones to pull, but they might be. But what it's doing is it's allowing our teams to go in and have a preview of these so that they can be corrected if there's any deficiencies, and they can find trends as well. So we're happy to be able to find that. Pardon me. The next thing, yes.
Just a quick question for you. The previous form that you were showing, does that goes into which sheet?
It goes into the base sheet for every department. So every tracer, we create a new one every time we go out, and it has its own, we use a template form, and it has its own tracer form that goes with it, and then we send it to ourselves each time. So it's all very, very specific to whichever location we're going into, but the information on the form is identical no matter where we're going.
Gotcha. So you just recreate it for each area that you're doing the tracer for.
Right. We have a tracer template, and we just go in, and when you open up the template, it lets you save it. We save it with a new location of where we're going, and we're good to go for that day. Another thing that I was going to tell you that we use a lot in this particular form is if somebody answers something and they forget to, they could just say they changed the status to complete, and they put a date that they completed it, but they don't fill out the resolution. We really need to know what they did to fix it. So the automation is built in there. If they leave this blank, they will get an email that says you've left something blank and we need you to complete it. The reason we do this is because probably all of you know that sometimes things you fix don't stay fixed. So we like to know how it was fixed so that when we go back into that area and look at it again, we can see, is the resolution that they gave, did it really fix the problem, and is it sustainable? So it just helps us be able to help them in that process. Another thing that we do a lot are some of the things over here. I don't know if you guys use them, but again, if you take photos, they will show up as a gem clip. So it'll show up as an attachment. If there is something that we see that we feel like is not explained as well as we would like it to be explained, then we go over here and use the send update request. This sends just the row to whomever you want to send it to, and it says we need you to fill this out, and we can put a note in there of what we would like them to do. This goes straight to their email inbox. They can complete it there, or they can come back to the sheet. I really love the fact that everything moves back and forth. Another example of that, a great one that we use regularly, is this comment button where you can add a comment to someone. So if I wanted to send Katie something, all I would do is put the @ symbol, and I would put Katie's email address in there, and I would send her a little note. Well, the note is going straight to her inbox as well, so that she can see it there. She can reply to that email just like she would any other email, and it comes back to the Smartsheet. So I don't know if you guys do the same as I used to do. I would try to save the last email in an email thread because it had all of the information in there. Smartsheet's doing that for you, so you don't even have to save those emails. Even if they respond to it back through the email thread and never touch the Smartsheet, you can have an ongoing conversation that will live in this bubble in your Smartsheet. So at any given time, you can go back and reference whatever the conversation was about that. So if you're not using that feature, I highly recommend that as well. So
Regina,
yes, go ahead.
Regina, quick question for you. With the comment history, do you ever leverage that as a lessons learned? So if you have a similar finding pop up, so you can refer to get clarity on how a similar one was solved previously?
We do, because sometimes things do change, and we can go back and reference that. We use it especially when we are going back out into the departments to look and see if the resolutions were fixed. And then we can go back and say, that didn't really work. So can we, is there something else we can look at? So great question. So yes, we do use that as leverage. Or do you remember this conversation we had? And it has worked well for us in the past. Another thing that we've built into all of our tracers is this sheet summary. And this is a tally basically based on status. It's going to tell us how many from this page is where they're at in progress. So this page has 21 that were complete, 10 still in progress, 3 not started, and 34 total findings. So that is actually sent over to a report page. There's just a simple findings. It's saying my comment didn't say, which is fine. And it's just doing a tally of all of our pages. And this filters into our our dashboard that I'll show you in just a minute. We also do something, every tracer we do, we keep a record of it so that we'll know where we've been. And yeah, we have the location of which facility, where we went, the dates that it was done, and then any comments or things that are still pending out there, and then the dates that it was completed. Again, this page also has a summary, so that's going to show up later on our dashboard that you'll see that as well. I'm going to go ahead and show you that, and then I want to go back. We do tracers for our patient charts, and I want to show you that at the end. So let's go ahead and look at the dashboard first that this filters into. If you're ever wanting to know kind of how much you've done, just to qualify what your staff are doing, this is a great way to do it, to show your leadership, kind of where you've been and what's going on. Pardon me. We have tracers by location. So I showed you the form that it tallies. It lets us know quickly how many times we've been to each hospital. And it lets us know where we may need to go next. So if we've got one that's got, 30 or 40 visits, then one that's, got 20, we can realize we probably need to focus on that one next. We've done, as I said, over 135. The findings identified that's totally from each individual sheet show up in this section. And you can see at a glance how many or what our total findings were for that calendar year so far, and then where they are in progress, how many were completed, how many are still in progress, and how many are not started. So again, our organization has done over 135 tracers for this calendar year so far, with a not to be disclosed number of total findings. So we're just going to keep that to ourselves. The little chart down below, I think, is a good representation if you want to use this. If you have one organization, one chart is fine. If you have multiples, you might want to sort it out by facility, because it can get very cumbersome with a lot of tracer findings. But it's just a quick red light glance of what's going on. It's the same information that's up here up top, but it's more specific about where you're at and which tracer might be complete, which one might not be complete, that you might need to focus on. If you got one that's got a lot of red on it, then you'll know you need to maybe go back and look at that one. So it just gives you a little more quick glance. This is also really great for your leadership to see, because it just does validate the work that you're doing and what you're finding and where you may be able to spot in some trends and get some things fixed that tend to keep popping up. So the thing I wanted to share with you next is our ATAG tracer. If you're a hospital, you know about these, because this is a CMS tracer. They come into your organization, and this is how they look through your patient records. Joint Commission is just who our accrediting body is, and I'm sure there are others out there that use the same thing, because if they survey on behalf of CMS, this is how they survey. So we have taken that tracer or that survey tool that CMS puts out and says, this is what we're going to look at. We have converted that into an actual Smartsheet, and you'll see it's very long. It goes on and on and on. But it is looking at the patient's visit from the moment they were admitted to the point they were dispositioned from the hospital, and in everything in between. It's looking at their medications. Do they have any titrations? Were those done correctly? Was the care plan specific for the patient? Were they on restraints? Do they have their allergies documented? Did we give them their patient rights? Did we go over that with them? Did we include them in the conversations of their care? Do we make them a part of that? It just, like I say, it covers everything. So we have made this to try to be user friendly, and we've made the questions in such a way that they're all yes, no answers, so that you can go to the same form and actually just do this in a yes, no process. The really cool thing about this one is we have given this to staff and asked them to look through their tracers, and they probably will want to print it off, because you really need to do this in kind of one setting. I think Smartsheet has a bill coming later where you can save your work and then go back to it. But currently you have to, when you submit, it's done. So staff will print this off and they'll answer the questions. Once they go in here, if they choose to go in and put it in, they can also send themselves a copy of the responses. That filters back to this base sheet. Sorry, I clicked on the wrong one. And we were able to put notes and things in there if there were any issues that were found during the tracer. If the chart looks good, if it doesn't look good. A couple things this does that we feel are really important. One, it lets us know if there are problems. If we have, for instance, if the patient got blood, we've recently changed our blood policy to have a start rate at 120. The previous policy was 50. So if we're doing a tracer and we see that the blood was started at the rate of 50, then we know that that nurse did not follow the most current policy. So we can use that as an educational opportunity to them to make sure that they understand that the rate has changed. Other things are if the care plan is not specific to the patient or the education pieces are not there, the patient is still in-house, we have a real opportunity to make sure that patient's care is enhanced. We feel sometimes staff are doing things, so just don't always document what they do. But we know the world we live in and we know things have to be documented. So we try to look at these with a very clear lens of making sure that the documentation is as tight as it can be. So any variances in that will show up in this tracer and we're able to get that back to the leadership of the staff and say, hey, can you look at this one? The really good thing about having staff look at this versus just us doing it is when they see things are well received from peer to peer. And when your buddy says, hey, you didn't, add this to your care plan, it's well received from them. They'll always take things better from a peer than they will from anybody in leadership generally. Another thing that we've encouraged our nursing leaders here to do is to make this a part of your clinical ladder process. So your nurses or your team that's on the higher clinical ladder, have them do this. Have them do these chart reviews as a part of that process. One, it gets them in the record, not from the input side, but more of the clinical quality side and the output. So if they get seated with a surveyor who's wanting to go through this, they know where to find these things. Our staff are really great at, where they put it in, but sometimes coming back and looking at those output areas where we just want to see, where the medication was administered and all this stuff. You don't have to go, it's just a different view. So it helps them learn how to navigate in a little bit different way. So that's been something we have also encouraged. The second thing is some of the hospitals won't always have a patient for every type of patient the surveyors will want to see. A critical access hospital might not have a blood administration patient. They might not have a restraint. You might not have a recent death. So it gives you an opportunity when a surveyor says, hey, let me see a death chart from the last 4 months. We can go to this document and drill into location and find those charts for them. So it's just a really good tool to help us be able to be more efficient with that whole process. So we love this. One of the things that Katie has asked, and we have done this because this is not a copyrighted document. It's out there on the web if you want to go look at the ATAG, but we have made this available to everybody if they would like to have a copy of this sheet. So I think Katie's going to tell you how you're going to get that.
Yep. So we'll post a link to this template set with the recording after today's session.
Okay. And that's really all I have to talk about as far as the survey prep session. So I think, Katie, do we have any questions from the community that we want to talk about before we move to the next step?
We do.
There was one about the dashboard,
Okay.
Regina. Like how do you share that with leaders or people at the organization?
I mean, it's a simple share. You just share it like you would any other document. And usually I make dashboards read only for this particular purpose, just because there's no reason for them to, to edit anything. But for my chart that I have down here, they can go in and click on this and actually see the tracer for these. So they have the ability to see this information, but generally a lot of the dashboards are read only, but it is a simple share. And they do go in and look at it. So it's helpful because it lets them know that we are doing what we need to be doing to stay compliant. And our goal is to be survey ready at any moment in time, because if you're Joint Commission or CMS accredited, they don't tell you when they're coming. Kind of when you're due, but you never know when they're going to walk in your door for any reason. So we try to maintain that survey readiness all the time at every location. But this just does let them see kind of what's going on, because they may not see you every day and they may not know where you're going or what you're doing, but this just lets them know what's going on in your world. And we can also use this as leverage to get things done. Like when we consistently see blood administration not being done correctly, or titrations, if they're not doing insulin, you know, for finding trends, whatever those trends are, this just helps validate that for us. Did that help?
Yep, I think that's a great question. We have another question. This one I'm happy to answer. It seems to be more like Smartsheet functionality. But we had a question that when forms are submitted with updates, previous notes, is that data overwritten against a record, or are new records created? And that's a great question. So when you use the form, so for example, Regina showed us a couple examples of forms that she uses today. That actually creates a new record. So it'll add a new row inside of Smartsheet. If we want to update the existing data in Smartsheet, we can leverage a update request, which would then in turn update the information within that row within your sheet. So hopefully that answers your question.
Yeah, that is correct. And it'll, depending on how you built your form, it'll either start at the top or the bottom. For our tracers, we have everything going to the bottom, and for our some other things, we have them going to the top. So that's where they will always land. You can also use dynamic view if you want people just to see certain pieces of that. So that's another opportunity to use dynamic view. Okay. Anything else before we move to the other part?
Yeah. Gina, there was a question, I think it's just more on your thought process or the methodology around the form you had.
Okay.
Is there a reason resolution of finding is not made to be a required form field if it is critical that they fill it out?
Is this for the ATAC tracer, or is it, did it say which one it was for?
I think it was,
Or is it for the departmental tracers?
I think it was the departmental, like that very first form you showed.
Okay. So yes, almost all of our things, and we love to find the good things that everybody's doing, but that's really not what we do. We are trying to find the deficits. But we do have sometimes some things that are just educational. And what we do for that is we just delete the start, due, and status, and then put informational only. That way they don't get the automated reminders. We know they know there's nothing that needs to be done with that. But other than that, yes, things do have to be resolved, because this is how we are getting ready for our surveyors to enter the building, and we want to know these things are fixed. But there is a way you can do it. You just delete the other pieces of it.
Mm-hmm. And I think too, Regina, they're completed by two different individuals, right? So the resolution's completed by whoever's assigned to it to say this is how we resolved it. Whereas,
yep. Yeah. And then we're just going back to look at it to see if we feel it meets the intent of what the surveyor would look for. We look for it, at everything through that surveyor lens.
Perfect. I think that's all the questions we have so far.
All right, so let's move on over to the day of survey. When they walk in your door, what are you going to do? And this is how we do for Joint Commission. I think you could do the same thing for any other hospital accrediting organization or whatever your surveyor process is. Joint Commission requires documents before they ever enter your building to be ready to hand to them as soon as they walk in the door. The last survey we had at one of our campuses, they had tasked us with trying to be more digital versus printing a lot of paper. So we're trying to save some trees, and we appreciate the fact that they are as well. So the first thing we do is we have this workspace already built out. But let's go to the document request. This is where we would actually request items from the individuals in our organization, whoever has ownership of them. So if we're looking for the CLIA certificate, we're going to tag that to the lab. If we're looking for an org chart, that's going to be somebody in leadership. So we assign these as who needs to respond to them. And then we want to know, I'll just run through how this is done. We have a complete written, means we've looked at it, it's done. We'll save this for surveyor. The document name, who we've assigned it to for completion, when we need it by, if they can put any comments in here, and then where it's going to be found during survey. Is it going to be, this is a drop down, is it going to be digital, or is it going to be on the document table? We save that document table for things that are too large. When the engineering comes, they come with a cart of like 8-10 binders. You can't put that digitally. It's just not appropriate to do that. So there are some things, blueprints, for instance. You need those in their big form. So some things will be on the document table, some things will be digital. We just need to know where they're at. So once everything is uploaded, it comes in as an attachment. You can clearly see it. If you click on it, there's your attachment for the first one. And then this is where it lives. So when the survey team arrives, we're going to get their email address. And this is new for us too. And we're really excited about this. This is part of the dynamic view. We're going to get their email address and we're going to put them in as requested by. We're going to add their names here so that when they actually start looking at the files, we're going to send them an email address or through their email. When they open up the file, they're going to see this, and it'll be a whole list of whatever their files are. They'll see the name, they'll click on it and be able to see the attachment. This does a couple things. They can download it or view it. This is just a blank file, so there's nothing really to see other than it just says document or hospital license, I think. What this does is this is going to allow them to be in the files. Multiple surveyors can look at the same thing at the same time. They're not looking for pieces of paper. They're not having to share. They can pull it up on their computer at their leisure as to when they're looking for it. Because sometimes when you overwhelm them with the number of documents that they're requesting, I mean, these are a lot of files. So when you have to provide this number of files to somebody, it gets a little overwhelming for them trying to find something. At some point, they're just like, can you show it to me? So this is going to hopefully help with that process, and they can, again, see the things that they need to see. Also, during the course of their tour of the organization, they may ask for other policies. Just say they're in the OR. They may decide they want to look at the hospital attire or the OR attire policy to make sure that they're following that. When that's requested, we will also add that to the bottom of this list along with their name. So again, when they get back to their surveyor headquarter room, they can look it up, see that it's there, and then look at it at their leisure. We're not trying to track them down and hand them pieces of paper and say, this is what you asked for. It will be right there in the list. So hopefully this will make their life a little easier, and it definitely will make our life a little easier, because instead of trying to get all these documents and get a book and put a book together and make sure things are updated, it all is housed in this one form. So this has been huge for us. We had already started this prior to them asking for it digital. So when they asked for it, we're like, we have a solution for that. It's already built. So we're really excited to roll this out with our next survey. Let's go back to the next form that we do. Every day that the surveyors are in-house, we have two people assigned to them. We have an escort and a scribe. The escort is going to be someone in leadership from the facility that's getting surveyed. The scribe is going to be someone from our team. And we prefer the scribes to be our team, because they know, they're more in tune to what to listen for, or what the surveyor's asking. They know what, kind of where they're going, what they're at, what they're looking for, and what we need to know back in our command center. We do have a command center that is run by myself and our director. And so what we do is ask them to complete these notes on their phone as they're walking around with the surveyor. Again, it's a very short note, and it's not meant to be the entire visit. Just again, go into ICU. It's not meant to encompass everything that they see during that visit. It's meant to hit the high spots, and they may send us 8 or 10 of these during that one area that they're surveying, which is fine. We'd rather have them in small snippets. It's not meant, like I said, it's not meant to be a huge narrative. Each scribe actually has their own form, so you wouldn't ever see the names here. All that is in the background. It populates with their name, and it's got a date stamp with it. The location we already have pre-built by every location in the building. So it's a quick drop down of where they may be. We also have an other in there just in case they wander somewhere that's kind of different and we don't know, it's just not one of the populated list. We want to know what charts they're looking at. So if they give us an MRN number, then we can also go into that record while they're looking at it and just kind of see what they're looking for. And if we see any issues with it, we want to know who they're talking to. Are they talking, which nurses or non-clinical staff are they talking to? Which providers maybe they be interviewing? And then what are they asking them? What are they talking about? What are they looking to see? Are they looking at all the crash carts? Are they looking to see if staff can speak to your hospital fire safety process, or an active shooter process, or health equity, or your PI? All those things are kind of hot topics. We want to know what they're talking about. So they'll list that here. of what the surveyor is talking about and any notes they need us to know back in the command center. And then we want to know, are there any things that they feel have been identified as a potential finding for our actual in the survey report, or any trends? Are they seeing AccuChecks not cleaned appropriately in more than one location? Are they seeing that the locks in the crash cart are not, being changed out? Whatever that trend might be. And then that's going to, and then again, if they want to take pictures, they can take pictures of that as well and submit that. That also goes to the underlying sheet that we have up on a giant screen in our command center. This is one of the forms that I have built to start with the most current note or entry first. So everything would come on in row 1. So as row 1, as something else is entered, everything moves down. So everything new is on top. This lets us in the command center know, do they need anything? What's going on? What are they finding? Who are they talking to? Is there anything we need to share with anybody? So if we see that they are talking to everybody again about that health equity, we can send an email real quick out to the leaders of that facility and say, make sure you can speak to health equity. They're asking everybody about it. Make sure your staff is comfortable. They're not blindsided by any questions that may come their way as the surveyor makes their way to their department. It also lets us know where they're going next. So as they're tracing us, we're tracking them. So if they know they're going to if they're in ICU and they're going to go over to med surg after that, then we can call the manager of med surg and say, hey, they're headed your way. They'll be there in 5-10 minutes. It lets that manager catch her breath for a second, or his breath, kind of calm himself and notice, okay, the survey team's coming. They let their staff know. And it just gives them a moment to prepare. There's nothing you can do really to fix before they get there, but it just lets them mentally prepare for that surveyor to walk into their facility or into their department, because people do get nervous for the surveyor. And our whole goal is to try to alleviate some of that, which is why we do so much prep work ahead of time with staff. Other things that this gives us an opportunity in our command center to do when we see this come up on the screen is that our C-suite leaders also wander in and out during the survey, and they can at a glance see what trends may be happening or any potential findings that might need to be talked about. Or is there something that they're seeing that we feel maybe didn't get adequately explained that we might want to have a conversation later, or did they find something we really need to fix and we just got caught off guard by it? So it allows us in the command center to have those conversations with our C-suite leaders, that we may be able to fix something, while they're here in the building, if we need to, or start mitigating something, or again, have that conversation when they get back to their surveyor headquarters to say, hey, I think there was a misunderstanding here. Can we talk about it? So we use all of that exclusively to make the survey be as best as it can be. Did you have a question, Katie?
Yeah, actually, we have a couple questions, and I think this is why we're here talking about it. Maybe we should, go ahead and answer some of those. One of the questions was, are the scribes actually filling this out on their phone?
The answer is yes. They either, whatever they're comfortable using. We have some that use their phone. We have one that uses an iPad. And it's just whichever one you're more comfortable typing into. The phone has been a game changer to be able to use that. And we always preface everything. Even with a surveyor, we will tell them we're not on our phone. We're not looking at Facebook. We are taking notes, so that they know that we are still engaged in the survey, but it looks a little different. Technology has changed, and we have adapted to that as well. You can also use, again, a Surface Pro or something like that, but we have found that we've offered different devices to people, and almost exclusively everyone would prefer to use their phone because they're comfortable texting, and it's not much of a different format. You still get the same little keyboard, and so it's something that's known to them. And you don't have to have Smartsheet on your phone to be able to do this. It's a web application, so it just goes straight to the browser. And then we have it where it automatically updates with a blank form every time they submit it. So they're just continually keeping that form on their screen and updated.
Yeah. No, that's incredible. And that's a great call out that you don't necessarily have to download the Smartsheet app. You can still access it because it's a web browse in your web browser.
Right.
The other question that we had, I think this relates more to the document request portion that you went over, but the question was, when surveyors have requested information, can they then download the supplied documents for their use?
They can download it to their screen, yes. So if we had something we didn't want them to be able to download, we would just give that to them, you know, in person. But that's not to say they couldn't take a picture of it or take it home or whatever. But yes, these are documents that are available to them for that use. One of the reasons they also like the digital format is if they're searching for something, they can do a quick search in the document and find it and not have to read through 100-page infection prevention manual to find what is the, you know, what do we require for, you know, for this, that, or the other. So it just enables them to work a little smarter as well.
Gotcha. No, that's super helpful. And then the other question that we had was, I think it's more process specific, but a great question. For the required document list, we don't typically have a request from a specific surveyor. For an org chart, as an example, we just give them a file box with all the files to pull as they need. Is there an option on the Smartsheet to enter multiple names in the requested by surveyor cell?
Yes. So in this cell right here, when they show up to my organization, I'm going to put every surveyor's email address in this box right here. Because then that way every surveyor will get access to all of these files. So yes, there is a way to do that. The way you do that is when you go in and make this a file, you put here, allow multiple contacts. So that's how you open that up. And then when you hit OK, it just allows it. So great.
Thank you.
Yes, you can always do that. And it doesn't have to be an internal email. It can also be, you know, whatever their email address is, because they're not Tanner employees. So it doesn't matter if it's an internal contact or just a regular email, it will take both.
That's excellent. Thank you, Regina. And I think that's it for right now. We'll save the rest of the questions for after you finish up here.
Okay. So one of the other pieces that we built is just a small form that's command center notes. And we use this just internally within the command center of things that the surveyors are asking for. It's more like a to-do list. It just helps us keep up with what they want and did we get it to them. And so it's very simple. What do they need? Who requested it? And then where it is it in process or completed, or is it still pending? And any notes we may have about that. And then if you remember the document request, the files, we're going to upload that to there so that they can know they can go there and look at that. So that has been an easy shift over there. This is just kind of our checklist to make sure we're not forgetting something that they've asked for. One of the other things that we've done that we're super excited about is our competency files for survey. As you know, they have a competency session where they pull those files, which can get kind of cumbersome if you have a lot of people in the room. And historically, there have been, you know, anywhere from 50 to 70 people in a room, which can get overwhelming. There's a lot of sidebar chatter if you're not talking to them specifically about, you know, a manager about their employee. So we built this in the hopes of streamlining that process. A surveyor gave us, one of our surveyors, some of the things that they are looking for in that competency session. So we took that information from them and built the Smartsheet out. So we started with things that we know they need to know: the employee's name, their title, who their manager is, their employee ID, and their hire date. And then the other 9 things are the things that they ask for: job description, competencies, background checks, all of those pieces. One of the dynamic views that we have created is once we put a name in here and who the manager is, the manager is going to get an email that says, your employee has been picked for a competency file review. We need you to be available should they need you at this date and time for that session. Also, you may hear from HR if there's something in the file that they need access finding. It also blows out an email to that big, huge thread that includes HR, education, employee health, and the laboratory to say somebody has been assigned for a competency file review so that they can then start working on these 9 things that they have to compile. So there's no more email threads having to go to them. There's no, we don't have to contact them at all. They know in real time when somebody's name has been added. So that's been very helpful for them. And just as a note as to how they're using this, in addition to the yes, no's to make sure things are done, they are uploading these 9 items into the files and they are labeling them 1 through 9 so that when the surveyor asks for them, it's a very easy process of, okay, here's our job description. That's number 1. Here's our license. That's number 2, things like that. So it just makes that whole process go much more smoothly than it has before, because instead of having 4 different groups of people in the room, again, HR, lab, education, and employee health, instead of having all of those groups represented in the room plus the managers, now we just have a group of 2 HR people, possibly 3, and the surveyor, and they're sitting there this up on a big screen so they can see all the files nice and neat, and it just moves very nicely. I'll also tell you that before they go into that session, the HR staff will hide rows 1 through 9 over here, because we don't necessarily need the surveyors to see the yes, no's or the comments. We just need them to be able to see the things that they want to see, that we've got the files ready. They don't need to necessarily know the behind the scenes working. And then also, once this session is over, all of these attachments are immediately deleted, just to protect the employees' confidentiality for anything. So nobody has access to this information while they're doing it. So they have really been appreciative of this process. So this was a game changer for them as well. So go back to when I told you what the original form that I built, the very first thing that I built for Smartsheet was our survey response tool. Again, 2 hospitals survey at the same time, working on findings for both of them. This is taken directly from, turn the filters off, from the Joint Commission's website. So all of the information comes from what they send us in our response. If it was tagged to a CMS account, what manual we were served under, the safer matrix. If you're familiar with Joint Commission, you know they have a safer matrix, and we've got that color coded to match that. What standard did they cite us on? The element of performance, and then what did they see? And then usually I'll put a short finding in, because sometimes the observation can be rather, lengthy in their explanation or whatever. So we just need to know the short listing of that was the medication level error. We don't need to know all the who's and where's in that particular thing. We also have taken directly from their website the information that they need us to give back to them for resolution, starting with responsible party for the corrective action. Was it high enough on the safer matrix that leadership had to be involved? If yes, then these are here. If no, then they should be grayed out, because we don't need this piece of information. And then moving forward with all of the corrective action. When do we correct? When was it corrected? What are we doing to monitor our compliance with that? How frequently, and who are we reporting it to? And then any comments that we may need. These are all internal. These don't go anywhere. Joint Commission also gives you an opportunity to clarify something if you wanted to, that just didn't make sense during the survey process, or if there was something that was an error on the report or things like that, you can clarify. We have a button for that over here, a little checkbox. If we check that, then we're going to clarify it. Then the columns are white. If it's not checked, then those columns are gray. That way the staff know they don't have to put anything in those boxes. What I do encourage the responders of these findings. So these have an assignment, just like our regular tracers do, of who has ownership of this fix. And again, sometimes there are multiple names in here. Sometimes it may be 6 or 8 names in here of who we need to have hands-on to fix this problem. I recommend a couple things. One, you can sort by assigned to that's login specific. That way they only see the things that are there. So if I clicked on this, you would see nothing, because I don't have any assignments to me. So I made a one that you can see. If I were John Smith, this is what I would see if I clicked on, if I were logged in and needed to see this. So it's not as busy. It doesn't feel as overwhelming, and they can actually just work on the ones that they are assigned to. Also, the card view is very good for this, because it brings it up. It sorts them by the progress, either in progress, ready for review, complete, or uploaded. I'm going to move this one back here so you can see it. It opens up into more of a form type document that they can just scroll right down and put their resolution in. It gives you all of the same things that are in the grid view, but then you start talking about how did you fix it? And they can just easily enter this information into here. There's also an attachment right here, and we ask them for proof of their resolution, whether it's a photo of a fixed ceiling tile or a discussion ring or a junction box cover, or if it's self-education of a new process or a policy that they may have modified. We ask them to upload all of these. There's a certain percentage of Joint Commission hospitals who get a CMS validation survey. Should they enter our building, we want to be able to take them back to this document and pull up those attachments to show the proof that we actually did resolve those findings. So that just makes that whole validation process go more smoothly. Plus, we are required for Joint Commission to keep all of our information that we receive from them and our processes in perpetuity. So this will live in the Smartsheet from now until, forever. So once they correct all this and they get okay, and they feel like their resolution is done, they're going to move it over to this ready for review column. And that's where our team comes into play. We're going to pull it from here. We get a notification that something's moved into that column. We're going to pull it up and look at it and see if it makes sense. If it reads the way Joint Commission needs it to read, everything has to be in past tense. Nothing can be future tense. If it reads fine, we're good. We'll move it over to complete. If it doesn't read fine, we will do a row update request and ask them to go back and look at it. Or we'll use that comment bubble and have a conversation about something and ask them for some clarification. We're going to slide it back to in progress. So things may move around between these two columns for a while until we all feel like the resolution is complete. And once it is, it goes here. Once we get everything in this complete section, then we're going to go up to the Joint Commission website and we're going to open these up and we're going to copy and paste everything that we've resolved in here into their website. So we're not having to type anything in. It is a simple either copy paste, and if you have two screens, you can like highlight and drag. So it makes uploading to the Joint Commission very easy. And then once we're done, things go here and we know we are complete at that point. So this was, again, the form that started it all and has kind of been the hallmark of all the things that we have built moving forward from that. So I hope that made a lot of sense. Do we have any questions on this part of it?
Thanks, Regina. I think the first thing that I wanted to call out is the kudos that you're receiving. Just that you, Kate McCullough, she works with you at Tanner, and that you are just an absolute rock star, and that because of the work that you've done, learning how to use Smartsheet and your expertise with Joint Commission accreditation has really added a ton of efficiencies and really streamlined a lot of processes. So a massive thank you for pulling this together and then just sharing it out with everybody, along with all of your neat tips and tricks so folks can really harness and gain some efficiencies using Smartsheet.
Thank you. Yeah, I can honestly say that our processes have been much improved thanks to Smartsheet. I can't say enough about how much we have been able to automate and make our team, our little small and mighty team, be as efficient as we can. And it's been extremely helpful. So, and I thank you for that. And I thank you for thinking that our build is sufficient enough that people can gain some knowledge out of it. So thank you very much.
And the last question that we received is a template. Can we share out a template? And we do have a template that will be posted and available after today's session with the recording. So you'll be getting a notification about that, and then you can download and use that template. All right. And another great question. Amazing work. Thank you for sharing. Are you able to share your best, even if it's a guesstimate, for how much time has been saved for your hospital team?
Oh, that would be huge. Again, all I can tell you, it's hard to quantify that, but I would say we are at least, and Kate may have an answer to that too, because she's seen the work that our department, and Kate is my upline, so thank you very much for her kind comments. I would say we are at 100% more efficient than we were before. We have probably, things that used to take us 2 to 3 days now take us 1 day. So that gives us more days to go further, do more, look at more, talk to more people, help more people be survey ready and comfortable for the process. So yeah, 100% more efficient than we were. I'd say we were able to get at least double the work done that we were able to do originally.
Yeah, without a doubt, I would definitely echo that. I think that we are able to turn out sometimes 185 line Smartsheet tracer in a day. And that's start to finish. That's doing the tracer, making sure it's complete, pictures, comments, assignments, and everything out to leaders by the end of that same day. It's remarkable. I mean, that was taking us sometimes as much as a week to get one complete and sent out before we had Smartsheet tools. So we're much more efficient, and it's much more efficient for the entire system, honestly. And leaders are very appreciative of what we're able to do with this, and kind of dumbfounded actually that we can crank out what we do in the amount of time that we do. So it's definitely a game changer.
That's incredible. Like my mind, I mean, I've been working with Regina for a while now, but it just blows my mind to hear it. And you know, just given how complex and time consuming these activities are, that's incredible. So Regina, thank you so much for sharing this. I know we have a little bit of time saved just to break everybody out into smaller groups, just so folks can kind of chat, ask any additional questions, maybe share how you're using Smartsheet. And we'll jump into those for about 15 minutes. But what I really wanted to also ask, and again, kind of tying in with some of those efficiencies, but from a change management perspective, Regina, were there any challenges that you encountered with getting team members to adopt a tool like Smartsheet?
We really were blessed because, again, we started with this first sheet, and the leaders that we had on this, we did have to do some education because not everybody had Smartsheet. Not everybody needs a license, obviously, to go in and do this information. So Smartsheet was new, so there was a training curve with that, but it wasn't a big one. But I think the benefit was that these same leaders had seen the previous process. So when we gave them a better solution, it created a buy-in, and so it just trickled down to everything else. So we have complete leadership buy-in for this product, all the way from from the C-suite down. So we have had no issues with implementation. We've had other leaders come to us and ask us to help build things because they see the efficiency that's there and see how it has changed the way we do things for the better, because they were part of that same tangled process of sending, do you have the right email? Do you have the most recent Word document? So it was kind of like seeing it in action created that buy-in for all of them.
Regina, what advice would you give to anybody that's on the call that's like maybe where you were a few years ago? Like, how do I approach this conversation, or like, where do I go?
Well, I think necessity is the mother of invention, which is what we see in this and what we've done. But I think the thing is don't be afraid to try something. Take some of the tools back that we've used. There may be a better process for what you're using, and your survey process may look different than ours, does. But I think some of the key pieces are there. And if you need to have those conversations, again, not everybody has to have a license, so that may be a financial, thing. You just have to have an email address to be able to do some of these. But I think once you start in it and you can show them the proof of your labor, I think I don't think you'll have any concerns with it. But the software, you can't break it. So just get in there and try and play with it and see what you can build that makes your process better than it was before. And you've got great people behind Smartsheet. I have reached out to the Pro Desk. I've reached out to Katie and Drew and Sean. I've reached out to the technical support at different times for different things I was building, and they all come back with great solutions and answers, and they're all right there to help you build the best thing you can build.
Thanks, Regina. I think that is incredible advice, and thank you for sharing your experience with everybody. All right. Any last questions for Regina before we head into a very quick small group conversation, but would like to carry this conversation and hear more about how folks are using Smartsheet. But if there's any last minute questions, please feel free. We'll join back together about 5 minutes to the top of the hour. So if there are any outstanding questions, we can ask them then, or we can also submit them via our Q&A form as well. All right. So I will go ahead and I will send everybody. We'll have a great conversation, and we will rejoin here at 2:55 Eastern time. All right. All right. And for folks that are still here, you may just need to accept the room invite to move into your breakout room.